Hi mamas, and welcome to Beyond Birthing channel. In this video, I'm going to show you how to massage your C-section scar in order to reduce adhesions and promote healing. My name is Sophie Villeneuve and I'm a pelvic health physiotherapist who's all about helping moms to prepare and recover from birth while nailing your pelvic health. Did you know that when you have a cesarean birth, there are actually 7 layers of tissues that are being cut in order to get your baby out of the uterine? So when these layers are healing after the surgery, instead of healing nice and loose like they were before, sometimes there can be, and most of the time there will be some adhesions. So it's called scar tissue adhesions, and it will kind of restrict the mobility of those layers. But the good news is you can actually prevent that to happen if you start massaging your scar early enough. Now, when should you start these techniques? Normally around 6 weeks postpartum. However, I've definitely had clients of mine who I ask them to wait a little longer. So get clearance from your physician or your pelvic health physiotherapist before starting these techniques, and make sure that they are appropriate for you at your stage of your healing. So the first thing you may want to do here is first look at your scar. So some people have even trouble looking at their scar in the mirror. So you first want to have a good visual look and just kind of get used to that image. A lot of women have trauma around their cesarean birth. So that's really the first contact you want to have is a visual contact. So you can use a mirror, and then you want to just kind of do gentle touch. So can you actually tolerate just a gentle touch? If direct touch on your scar is already a bit yucky, you can just go around even. So indirect palpation. And then you're kind of making your way closer and closer, and just being okay with that already is an exercise in itself for some women. Then what I'm going to ask you to do is take 2 fingers and put it at one extremity of your scar, and then you're going to apply gentle pressure to push the tissues down, and then you're going to start moving right to left. So you're doing this 5 to 10 times, and then you're going to go up and down. So same thing, going into the stretch. And then the third technique is circles. So you can do circles clockwise first. So do 5 or 10 of those. And then going in the other direction, 5 to 10 times. And repeat those techniques until you've covered the whole scar. And another one that I like that I'm going to show you here is the stretch. So what you're going to do is put all your fingers along your scar, and then you're going to press down and then up. You're going to hold that for 30 seconds. Now, once you are farther along, so I would say around 6 months postpartum is the earliest you want to consider this. There's a technique called cupping. So you use a little suction cup like this, and that can be good for when you have an overhang. So if your scar is so sticky that the skin over top kind of hangs over top, the cupping can work really great for that. So here I'm going to put a little bit of gel because that's what I have, but you can use massage oil for this because we will want to move along with our cup. So what you do is you take the air out by kind of putting your thumbs in the middle here, and then your other fingers around, and then you put it directly onto your scar, and then you release it. And I don't know if you see here, but my skin is kind of entrapped in the cup, and you can move along like this a couple times. It's quite intense, so you can do it in other areas first, like even in the upper belly, just to get used to the sensation. And then when you want to release, you can put your thumbs in the central part and just lift it off. And you'll see here that it marks my skin a little bit, and that's totally normal. So yeah, you can use the cup to do just lengthwise, just slowly, like 3 to 5 times. Or you can also do the other techniques I showed you earlier. So I'm just going to reapply it here, but you can do up and down, side to side, and circles with your cup. And then you're going to move to another part, and then 5 to 10 times here, 5 to 10 times there, circles. All right. If you want to learn more about all my programs to prepare and recover from birth, make sure that you check out the links in the description below. As always, thanks so much for being with me today, and I'll see you later in another one of my videos. Bye guys!